Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Well, we've got some real movement at CMS recently and wanted to bring that to your attention. Just this week, we learned that the upper limb prosthetics coding guidance has been retired. You could call it rescinded, but ultimately it's no longer applicable to upper limb prostheses. This is a pretty big victory. This is something that NAAOP is very proud of in working with its alliance partners to change this scenario. Let me rewind a bit. Last year at this time, at the end of March, the DME MACs proposed a coding guidance for upper limb prostheses that many consider to be problematic. The NAAOP and many of its sister O&P organizations came together and discussed the impact of the policy. It was very detailed. It really delved into the weeds to a significant extent, and if you didn't do upper limb prostheses, you probably didn't know a whole lot about it. But those who do, and the experts who understand upper limb coding, realize that this was a real potential negative for access to patient care. And in fact, within about 2 weeks, we learned that even some private plans were starting to implement guidance that CMS had promulgated that really restricted access to upper limb technology, particularly for partial hand prostheses and individuals who need partial hand prostheses. We went to work. We consulted with a number of the experts in the field, ultimately compiling a 18-page substantive comment to the coding guidance and submitted that to the DME MAC medical directors and CMS. We then met with the Centers for Medicare and Medicaid Services in September of 2022 and shared with them our concerns about the policy, how it was promulgated. There was no public notice or comment. There was no opportunity to comment on the substance of the policy before it became live, and challenged that. We made some progress during that meeting, but we really felt we needed to press further and meet with the DME MAC medical directors and the PDAC medical director to make sure that those who are administering the code set, those who issued the coding guidance, understood our concerns. While we did get a letter back from them that summarized some of their positions, we didn't feel that we had gotten any resolution on the matter. Just last week, early March, we did meet with the DME MAC medical directors, the PDAC medical directors, and director, and a number of CMS staff, as well as the O&P Alliance team, NAAOP, and of course our upper limb consultants or experts who we were working with throughout this process. We had a very substantive and positive 1-hour meeting with the DME MACs and the PDAC. We were very heartened by what we learned and by their receptivity to our message. Ultimately, we just learned this week, a few days after that meeting, that CMS did, actually the DME MAC medical directors did in fact retire the policy, which means that we're back to where we were last year prior to the policy being issued. We're very pleased with that. Before upper limb prosthetists begin billing codes, please try to be cognizant of the fact that there are other rules in place that have not been retired. So be careful about how you're billing. We are continuing to follow up with the DME MAC medical directors and try to figure out exactly how to proceed. There is a willingness to revise existing codes, to update many of the outdated codes, and a willingness to fill some of the gaps and create new codes for technologies that are not currently represented in the HCPCS code set. So all around, a real victory and a real step forward. I want to thank Chris Baschuk, Pat Prigge, Chris Lake, Jerry Stark, Eric Ramcharan, John McGillis, and especially Megan Hodgson, who spent an incredible amount of time drafting and putting on paper some of the Alliance's comments. So this is one major advance, but there is another important policy that CMS is moving forward with, coverage of seat elevation in power wheelchairs. That may not assist everyone in the O&P field, but many people with limb loss and limb difference do utilize wheelchairs in their home. And this policy would permit coverage of seat elevation. The comment period ends in March, and we're looking forward to a positive coverage determination there. We think that's kind of a milestone. We think that that's an important development in how Medicare views the DME post benefit, and we're very heartened by it. So stay tuned for more news from NAAOP. We appreciate your support.